Good morning, everyone. Thank you so much for attending ONEgeneration's Health and Wellness Webinar Week. We're so grateful just for you taking your time and joining us today just to learn about some amazing topics. For those of you who do not know me, my name is Niambi Cooper, and I am the director of ONEgeneration Senior Enrichment Center, and we're led by our organization's president and CEO, Jenna Haas. So this webinar layout is going to be composed of us first having our presentation, presented by Roger. And then at the end, we will have a Q&A question and answering. If you want to use the chat function to input your question, or you can use their Q&A box at the bottom panel of your screen. If you want to ask a question anonymously, you can do that as well. Or if you just don't want to use the chat box, that's fine. You can use the raise your hand function at the bottom part of your screen, and that way you're verbally able to ask us a question. So this presentation is being recorded, and that just simply means that we're able to place this recording into our newsletter, and that way you're able to rewatch it and share it with friends. If you currently do not receive our newsletter, you're able to go online and type in onegeneration.org, and then you're able to input your email into our website, and we're able to just hit submit, and then we're able to send that to you on a monthly basis. Also, if you want to just give us a call at our office at 818-705-2345, we can sign you up that way as well. So I'm super excited to introduce to you Roger Williams. He will be representing Advantage Plus nurses, and his presentation today will be titled Living Longer and Healthier by Managing Blood Pressure. So this presentation is super important because high blood pressure has no warning signs, and many people are unaware that they have it until trouble presents itself. So uncontrolled blood pressure can lead to serious health consequences as we get older. Fortunately, high blood pressure is easy to detect, manage, and control. So today we'll learn just how to take practical steps to improve your health and lower your risk for heart attack and stroke by managing your blood pressure. So thank you so much, Roger, for joining us today and just everything that you do here for ONEgeneration. I am super excited to have you.
Niambi, thank you so much for having me here. And I'm also very excited about this topic, and it's one of my specialty areas. As you know, and as others may not be aware, I am a practitioner of public health with specialty training from Harvard and also from University of Pennsylvania in hypertension control in particular. And I have designed numerous projects, numerous programs, including the ONEgeneration Blood Pressure Control Program. And we have been very, very successful at helping people to reduce their risk for heart attack and stroke by managing their blood pressures. So I'm excited about the conversation. And let's get started. I know we are limited on time. So let's take a look at the first slide.
Okay, let me go ahead. Can you see my screen?
I can see your screen now. And so Hypertension Control Program 2021 from Advantage Plus Nurses is a hybrid program that has been developed from all the best practices in blood pressure control. And so let's go ahead to the next slide and jump right into it. So first I want to talk a little bit about Advantage Plus Nurses and who we are. And Advantage Plus Nurses provides patient-centric healthcare management services for seniors who are living with chronic disease. One of the things that we need to know is that the number one risk factor for all chronic disease is age. And so as we get older, we're going to experience a number of different health challenges. Hypertension is one of those that is manageable. And so we want to make sure that we have the conversation, that we start the conversation early, and that we are informing people about the risks associated with not managing hypertension. And so one of those risks I want to talk about right now, although you cannot see or feel it, blood pressure gives your doctor a peek into the workings of your circulatory system. And a high number means that Your heart is simply working too hard to pump blood through the body, which can result in thickened heart muscle and potential heart, kidney, and brain damage. And these are serious consequences that lead to heart attack and stroke. And the number one reason why we want to be able to reduce those risk factors outside of the obvious reasons is that as we get older, it is more and more difficult for us to be able to recover from serious illnesses. And so what we know is that managing our risk for heart attack and stroke and cardiovascular disease through lifestyle changes primarily, and sometimes medication, is very, very important as we grow older. So let's go ahead to the next slide. So nearly half of all American adults, 46%, have high blood pressure, according to the American Heart Association. That's more than 100 million people. The number we think is closer to around 108 million people. So somewhere between 103 and 108 million people in the United States, adults in the United States, have high blood pressure. Many of them don't even know that they have it. Untreated hypertension is the leading cause of stroke, and controlling blood pressure is the best prevention against heart attack and stroke, according to Harvard Health Publishing. And Niambi, as you pointed out earlier, high blood pressure is easy to detect and to treat. And in many cases, people can actually reduce their blood pressure or bring their blood pressure to within a normal range just by adopting some basic lifestyle changes. Now, I'm going to just go ahead and say what that number one lifestyle change is. For people who smoke, we really want to encourage you to not smoke and to quit smoking. Self-managed blood pressure or self-managed blood pressure monitoring with some additional clinical support is known to be very effective at managing and controlling blood pressure, according to the American Journal of Preventive Medicine, but also according to the results that we have been able to achieve at ONEgeneration over the last several years. And then finally, at Advantage Plus Nurses, what we have also been able to do is achieve certain results coming from our hypertension control program. Let's go ahead to our next slide. So these are some of the basics, and I don't want to go in really, really deep, but I know that I wanted to have a conversation that talks about the physiology, the basic physiology and anatomy of blood pressure. And so what we are looking at is, of course, the heart and the major blood vessels. The largest blood vessel in the body being the aorta. And the aorta is where blood pressure begins its journey throughout the body, right? So the left ventricle of the heart will force blood into the aorta, which expands and then moves blood through the circulatory system. This is known as the systemic circulatory system. And that's where blood pressure is being created. So some of the basics that I want to just cover very, very quickly, and you don't even have to remember it. I just need to know that you have heard it during this discussion. Here are some basics. Number one, that arteries carry blood away from the heart and veins carry blood back to the heart. Our main concern with respect to blood pressure is dealing with how arteries carry blood away from the heart. Now, hypertension causes damage to the heart, blood vessels, but also the eyes and the brain and the kidneys. So these are very major concerns that we want to have a conversation about starting from these hypertension basics. Let's go ahead to our next slide. So now there are two blood pressures, and we just want to mention that for people who are unaware of it. Pulmonary blood pressure, which is not measured, is blood pressure that is occurring in the lungs where gas exchange takes place. Systemic blood pressure is the one that we are measuring. And in looking at the diagram that's in front of us, as we stated, so the origin of blood pressure begins in the left ventricle, which pumps blood into the aorta, which then pumps blood into the systemic circulatory system. Where we are measuring blood pressure, generally, although there are multiple points where we can measure blood pressure, generally, we are measuring blood pressure at the brachial artery, All right, and we're going to come back and we're going to talk a little bit about that. But for right now, let's go to our next slide. Yeah. So one of our major concerns, as you can see in this diagram, the big red blood vessel that is running to the kidneys is the aorta, which we remember began in the heart at the left ventricle. It also descends in through our abdomen, and then two big blood vessels, the renal arteries, are the blood supply for our kidneys. And so high blood pressure causes damage to the renal arteries and the kidneys. Kidney failure can lead to dialysis care. And so by understanding our blood pressure, we can reduce our risk for kidney damage as well. Let's go to our next slide. Now, this is a major concern. Hypertension causes damage to the brain. What we're looking at in this diagram are the two major types of stroke. Hemorrhagic stroke occurs when a blood vessel in the brain actually leaks or breaks. And then the ischemic stroke occurs when a blood vessel is actually blocked. And that could be caused by plaque buildup in an artery, or it can be caused by cholesterol that breaks away and causes a blockage within an artery. In both cases, managing blood pressure reduces our risk for either type of stroke and for all types of stroke. Let's go to our next slide. So there is a major salt connection. The salt connection, and salt does not affect everyone the same way, but half of people with high blood pressure are salt sensitive, meaning that their blood pressure rises by 10 millimeters of mercury with a high sodium diet. That includes your potato chips and bread and Wheaties and Cheerios and all these items that are containing high levels of salt. Particularly, we should be having conversations about potato chips and Doritos and pretzels and pizza and reducing our intake of sodium. And although African American adults are 40% more likely to have high blood pressure than their white counterparts, they are significantly less likely to have that condition under control. So there are certain genetic components that we should have a conversation about too. The idea being that we raise awareness of salt sensitivity and hypertension and the connection between those two things. Let's go ahead. So in measuring blood pressure, what most of us have heard is that there is a systolic reading, which occurs when the heart contracts and ejects blood into the aorta, which we looked at earlier. This is the heart's working phase. And then the diastolic blood pressure, which is the heart's relaxed phase. And the concern that we have is that with high systolic blood pressure, the risk for heart attack itself is higher. With high diastolic blood pressure, the risk for heart failure is higher. The reason being, with systolic blood pressure is when the heart is actually contracting and forcing blood into the body. With the diastolic blood pressure, what's happening is that the heart is not relaxing enough to fill up with blood. So we want to pay attention to any blood pressure that is greater than 120 over 80 millimeters of mercury. Now, those are the new standards, and that makes it really difficult for many of us who were living with a blood pressure of 130 over 90. That is now considered to be an elevated blood pressure. And as we get older, because our blood pressure rises with age, we want to start to have the conversation with seniors about bringing our blood pressure levels even lower. And there are some very, very simple ways that we can actually achieve that. This is the number one way: starting to have a conversation, educating our seniors about blood pressure, and then taking real world steps to reduce that blood pressure. Things that we can do on a daily basis. And we're going to get to that in a couple slides ahead. Go ahead and let's take a look at the next slide. So as we were discussing, so these are the classifications for blood pressure. In one category, normal blood pressure is less than 120 and less than 80 millimeters of mercury. And so if your blood pressure is reading within that range, that is great, right? So a range of from 120 to 129 over 80 to 89 is a range that we can live with. We can live longer and healthier with. And I think that we are less concerned about blood pressure measurements that are within that normal range than we are with blood pressure measurements that are going to be from 130 to 139 to 80 to 89, right? Which is stage 1 hypertension or elevated hypertension. The key thing that happens here is that we want to start to change some aspects of our lifestyle. Again, for people who smoke, the number one recommendation is that we quit smoking to reduce our risk for cardiovascular disease. The next thing that, there are a couple of simple steps that can be taken. One, of course, again, is to quit smoking. The next thing that we could talk about is dietary changes, reducing the amount of sodium that's in our diet. And when we look at how to reduce sodium in our diet, think of it as being a bank account, and that on a daily basis, you have $1,500 to spend. I wish I had $1,500 to spend on a daily basis, but I don't. But consider that 1,500 milligrams of sodium is your daily allowance. And by looking at the foods that we are eating, by looking at the labels and understanding that something that we eat for breakfast may have 250 milligrams of sodium in it before we even get out the door. We now have, for the balance of the day, 1,250 milligrams of sodium. And so by looking at what we eat throughout the course of the day, we can start to manage our sodium intake. Now, stage 2 hypertension is a consistent measurement of 140 over 90, this is where we start to have some concerns, because the number one risk that we need to look at again is that as we get older, it becomes more and more difficult to change some of our habits. It becomes more and more difficult to also manage our weight. And so, as hypertension is persistent over a period of time, it is more and more difficult with age to reverse the damage that has already occurred. It is not impossible, and particularly for people who smoke, it is not impossible. And so, by reducing or cutting out smoking, maybe going into a smoking cessation program, which is one of the programs offered by Advantage Plus nurses. And for anyone who might be interested in quitting smoking, please be sure and message me later in the day following this presentation. There will be information on how you can contact me regarding that. And for anyone who does have hypertension right now, whether it's physician diagnosed hypertension or if there is a family history of hypertension, please be sure to inquire about how to participate in the hypertension control program. And again, at 140 over 90, what we want to start to do is change health habits and take medication. And I know that many people are adverse to wanting to take medication. However, there are many components to hypertension that could cause us to need to take medication. And although some medications have side effects, there are more than 200 medications that are available to treat hypertension and reduce risk for cardiovascular disease. And so if one of those medications is not working, perhaps another medication will work. And so it's important to have a conversation with your physician if you are having certain side effects resulting from the medication that you're prescribed for hypertension or any other medication for that matter. Now, I just want to make sure that I say this. So higher than 180 over, this is saying over 120, but in reality, higher than 180 over 108 diastolic blood pressure. At 108, there are severe health consequences that need to be considered. And we look at a diastolic blood pressure of 108 as hypertensive crisis. And so it's important, if you are measuring 108, that you have an immediate conversation with your doctor or seek immediate medical care. And depending on how you are feeling, you may need to call 911. So I just want to make sure that I say that if you have a blood pressure that is greater than 180 over 108, you may need immediate medical attention. All right, let's go to our next slide. So once again, and a lot of this we have covered, but it's important to cover this again. So lifestyle changes are very, very often needed in order to control blood pressure. The first thing, and I continue to emphasize this point, quit smoking and limit alcohol use. Number two, medication therapy. Take medications as prescribed, and if one medication is not working, then ask your doctor to conduct a medication audit and consider another medication. Number three, and this is really important. So self-management and self-reporting means taking control of your health. Being able to self-manage blood pressure means checking your blood pressure on a regular basis, number one. And number two, being responsible to report your blood pressure to either a health coach at Advantage Plus Nurses or a health coach at ONEgeneration. And then Weight management. So an interesting note is that for every 1 to 2 pounds of weight loss, blood pressure also comes down about 1 point. This is according to Harvard Health Publishing. And so your diet and exercise are very, very important in managing blood pressure. Stay away from salt, and walk on a daily basis. So these are some easy things that we can do about managing blood pressure. Let's go to our next slide. So African Americans and hypertension. It's important to point out that African Americans are particularly at risk. Not only are we more likely to develop high blood pressure, um, and are more apt to suffer from its complications. And as we discussed, it could be kidney damage, it could be stroke risk, but in all cases, there is a risk of damage to the heart and blood vessels. But African Americans with hypertension have higher rates of stroke, heart disease, kidney disease, and diabetes than whites who also have hypertension. And thus, African Americans are also more likely than whites to die as a result of high blood pressure. So these are important health consequences that need to be considered for minorities. Let's go to our next slide. So 6 steps to lowering your blood pressure. And for the sake of our time, I want to just kind of go through these quickly. The main thing that I really want you to understand with respect to change your diet, the dietary approaches to stop hypertension, known as the DASH diet, are known to be very, very effective in helping people to manage their blood pressure. Another thing that's really important, according to the Centers for Disease Control and Prevention, the CDC, getting 30 minutes of moderate intensity exercise 5 days a week is known to help lower the risk for cardiovascular disease and to help manage blood pressure. Now, I have to emphasize that it's important to exercise safety first. And so before starting any exercise routine, be sure to consult with your own physician. The next item is to attain a healthy weight. There are a lot of reasons why all of us want to try and manage our weight. First of all, we look better, we feel better, we sleep better, and our clothes look better on us. But again, for every 1 millimeter of for every 1 millimeter of mercury, so systolic and diastolic blood pressures drop an average of 1 millimeter of mercury for every 1 to 2 pounds of weight loss. So for every 22 pounds a person loses, he or she may be able to reduce systolic blood pressure by 5 to 20 millimeters of mercury. Even a loss of 10 pounds can help most of us. And many of us are saying and have set as a goal that we'd like to lose 10 pounds anyway. And now with restrictions being lifted, the so-called COVID weight, we can start to take a look at getting out in the park, getting out and regaining our exercise routines. Now, this next point is something that we've all talked about: reducing stress, getting enough sleep, having more relaxation, and spending more time with friends and family are really, really important aspects of maintaining our health and lowering and managing our blood pressure. And then again, I can't emphasize how important it is to stop smoking if you smoke. So quitting is hard, and we all have to make a genuine effort if we are smokers. And there is support for quitting smoking, there are a number of different programs that have shown to be very effective. And now, finally, reduce your salt intake. This, again, is a very, very important one. Over a 3-week period of time, managing our salt intake is shown to reduce our blood pressure. And so with self-management, checking your blood pressure on a daily basis, getting sufficient sleep, reducing weight, lowering weight, and managing what we eat, and then reporting that to a health coach in order to be accountable and responsible. Generally, what we have found is that people have been very successful at lowering their blood pressure by taking those types of lifestyle changes and by taking those types of steps. Let's take a look at our next slide. Medications. So research clearly shows the value of using drugs if necessary to treat blood pressure once it reaches stage 1 hypertension, at 130/80 to 139/90 or higher. So here is the thing I want to say about medications. Once again, there are more than 200 different types of medications that can be used to manage blood pressure. And your doctor will most likely want to start you off with a single medication, a vasodilator that will help to open arteries, and see if that helps to lower your blood pressure. And if not, then your doctor may choose to add an additional medication to your regimen in order to see the minimum amount of prescribed medication that needs to be used in order to try and lower your blood pressure to a safe level. And then this last point, hypertensive crisis requires immediate medical attention. We really can't stress this more than enough, because many people are walking around on a daily basis with hypertension that needs to be managed right now. The risks are simply too great. And for any cardiovascular event that might occur as a result of hypertension, it's more and more difficult as we get older to recover from those types of cardiovascular events. And so what's important right now is to at least start the conversation and to understand our numbers and understand what our blood pressure is. Let's go ahead to our next slide. So blood pressure management, how to take charge of your health, and the next slide. So once again, I just want to emphasize self-management. This is something that we can do ourselves, and it sounds really simple, and it really is. And so for many people, there are some who might wonder, well, if it's so simple, why don't we all know this? And I guess that's the point of the talk. Some of us might remember, for example, that we were only getting our blood pressure measured by our doctor or by the nurse when we went to visit them. And there was this big blood pressure gauge on the wall that was filled with mercury. And it seemed like this major scientific event that had to occur every time we went to see the doctor. Today, we have digital blood pressure monitors. CVS and Walgreens both have blood pressure monitors where you can walk in and you can check your own blood pressure. And we want you to start to be able to do that. This is something that you can manage on your own with some clinical support. And we provide that kind of clinical support for you. So check your blood pressure on a daily basis. Eat a sensible diet. And I know what that means. Cutting out pizza, in my particular case, is the thing that I have to do in order to stay healthy as I age. Self-reporting means that I can have a coach. If you're not using a clinical coach, maybe it's a friend. And maybe it's also maybe it's a family member who is going to help you to stay in compliance, be accountable, and take your medications as prescribed. Let's take a look at our next slide. All right, so positive steps that we can make, and I know we're going to get to some questions. I see some questions coming up here. Positive steps that we can make or that we can take to make a real change. The top 3 dietary recommendations are: change salt for potassium wherever possible. Restaurant and processed foods are the biggest sources of salt in our diet. So eating home-cooked food is the most effective strategy for cutting back. Blueberries, oranges, bananas, grapes, tomatoes are all good. Let's eat those. Unfortunately, the pretzels, the pizza, the luncheon meat, canned meats, canned soup, Cheerios, cornflakes, Raisin Bran are not good. And I know Cheerios and some other, I don't want to call out just Cheerios, but there are lots of foods that want us to believe that they are healthy for our diets, and they, in fact, are not. Top 3 exercise recommendations. So, physical activity guidelines are that we should get 2.5 hours of moderate intensity aerobic exercise during the course of the week, right? Becoming active can lower your systolic blood pressure by an average of 4 to 9 millimeters of mercury, according to the Mayo Clinic. Now, that doesn't mean you have to join the gym. Household chores, mowing the lawn, raking leaves, gardening, getting out and maybe walking with children and grandchildren, or with friends, being out in the park, dancing. If you love to dance, we want to encourage you to dance. But again, talk to your doctor before beginning any exercise routine. And let's take a look, I think, our final slide. So these lifestyle changes mean avoiding tobacco, losing excess weight, eating nutritious food, cutting back on salt, exercising regularly, and easing stress. These are the best ways to reduce our risk for cardiovascular disease by managing our blood pressure, and of course, raising awareness of hypertension risk and taking steps to improve your health. And let's see, I think question and answers. Now, also, here is information if you have questions for me. Roger at AdvantagePlusNurses.com. Roger at AdvantagePlusNurses.com is where you can email me. And then also toll-free number 800-395-2065. I'll say that one more time. The number 800-395-2065. You're welcome to call me with any questions, but I'll also take any questions if there are some right now.
Thank you so much, Roger. I know we have some questions that popped up in the chat. So we do have a question, and it says, is it correct that there are blood pressure medications that Afro-Americans should not take? Also, are there brands of home blood pressure machines that are more accurate?
Excellent questions. And in fact, so each person is different. However, the prescribing regimen is standardized. And so your physician will want to start you off with a medication that is a vasodilator, meaning that it can open up blood vessels in order to allow blood to flow more smoothly. Very often what happens, especially with where there are genetic components associated with hypertension in African Americans, very often what happens is that we're born with blood vessels and arteries that are constricted and that are constricted is the best word to use. And so, or that might be smaller. And I'll tell you one of the reasons why they might be smaller. So smoking from 2 generations back can affect us today. Smoking immediately changes cardiovascular, and I'll just say heart and blood vessel physiology, heart and blood vessel anatomy. And so from 2 generations ago, and we have to ask these questions about our health history and our family health history. Do we know, did our grandparents smoke? Did our great grandparents smoke? Did either of your parents smoke? We may have a genetic predisposition. Okay, so in terms of a blood pressure monitor, now there's a lot of great monitors that are available to purchase. Certain monitors have been validated, like the Welsh Allen monitor is one of the best that's on the market, but it's very, very expensive. Here's what we want. We just want you to start somewhere. We want you to start somewhere, and we can establish a baseline. And if you want to know more about blood pressure monitors, through the program at ONEgeneration, we're able to get you a free blood pressure monitor. Also, the program at Advantage Plus Nurses, we're able to get you a biometric device that you can wear on your arm. So please be sure to give me a call regarding that or send me an email.
And a couple more questions. We have one, what is the best way to take a BP? Is it standing, sitting, left arm, right arm, AM, PM, average of 3 blood pressures, readings 5 minutes apart?
So, all right, so I'm just to confirm, average of 3 readings 5 minutes apart is great. There are a couple of different parts of this. Number one, we'd love for you to, especially if you're just getting started managing your blood pressure and looking at your blood pressure, I want you to take your blood pressure just during the course of the day. If it comes to mind, take your blood pressure. If you are carrying bags of groceries into the house, check your blood pressure to see what it looks like when your blood pressure is very, very high. Check your blood pressure the first thing in the morning when you get up. Check your blood pressure after you eat your breakfast. At first, I want you to start to just look at what the numbers are so that you can start to assess what your risk is going to be. Now, a couple of things regarding when. So your blood pressure is going to fluctuate throughout the day. And if you are on a medication, then generally your doctor is going to give you some instruction as to when he or she wants you to be measuring your blood pressure and recording that information. The main thing that I want to say is that I want you to become knowledgeable about your blood pressure. And so I want you to know what your highest blood pressure has been. I want you to know what your blood pressure feels like first thing in the morning, especially if you are like some people, if you are feeling dizzy first thing in the morning. And I hope that addresses that question. Oh, I'm sorry, just one other point. So in between blood pressure readings, if you do 2 blood pressures on the same arm or wrist, I'd like you to switch arm or wrist and measure blood pressure on the other extremity, right? If you're going to do a third blood pressure, or if you're going to take more than 5 minutes between readings. And the reason is that blood pressure, so the cuff is going to collapse the artery. And then as it starts to release pressure, turbulence in the artery is what the monitor starts to read. Now, after collapsing that artery a couple of times, your third reading may not necessarily be accurate.
Does anyone have any further questions? Of course, we can put his contact information into the chat so that you're able to, like you said earlier, you can give him a call anytime, and he can for sure address any questions you have. I'm getting some thank yous in the chat. And thank you so much, Roger, for everything that you do for ONEgeneration. And just thank you, everyone, for taking the time to just attend this topic for living longer and healthier by managing your blood pressure.